have been assigned a patient who has been diagnosed with breast cancer. She currently has a central line that is a single lumen subclavian located on the patient's right side of the chest. It is non-valved and has a clamp to prevent the invert of blood. It is currently infusing a medication called doxorubicin that is for the tumor, and it is mixed with 100 milliliters of 0.9% sodium chloride. The reason for the central line to be placed is so that the medication therapy could shrink the tumor and the patient will have a less extensive surgery. So the doctor has also placed an order to do a blood draw specimen collection for CBC, PT, and INR, and also the patient has an order for a dressing change to be done, as it is to be done every 4 days or as needed. So I have collected all of my supply, walked to the patient's room. Patient is on standard precautions. Knock, knock, may I come in? Yes. And hi. And then I'm gonna provide some privacy. I'm gonna wash my hands. Hi, my name is Vanessa. I'm going to be your nurse today. How are you doing today?
Pretty good.
Pretty good. May I ask what your name is?
John Doe.
And your date of birth?
September 9th, 1989.
Do you have any allergies?
No.
Okay, so the reason why I'm here is because I need to do a blood draw, and I'm also going to do a dressing change as it's due every 4 days. Is it okay for me to proceed?
Yes.
Okay, so I'm going to put some gloves on. And I'm going to put the bed up. And I'm going to turn off my infusion. And I'm going to clamp all my lines. And I'm going to remove it from the lumen, attach an alcohol cap. I'm going to put this one away. And then I'm going to flush the line, take the bubble out, attach it, unclamp, and I'm going to do a push pause right until I hit the 1 ml clamp and remove. And toss this into the trash. Now I'm going to wait 3 to 5 minutes before drawing any blood per hospital policy. It's been 5 minutes. I'm still at bedside, so now I'm going to alcohol swab the hub for 30 seconds, and I'm going to allow it to dry. And now I'm going to grab a new normal saline syringe, take the bubble out, attach it to the hub, unclamp, and here I am going to aspirate to check the patency of the central line. Looks good. And now I'm going to do a push pause. And I'm going to withdraw 3 to 5 ml to waste it. And the reason why I'm wasting is because there might be medication in the line, and I don't want it to contaminate any of the blood specimens. So I'm going to clamp and detach and toss this into the biohazard container. Now, I forgot to mention earlier that this, if it were to be a double lumen or a triple lumen, it will indicate which lumen is for a blood draw. So now I'm going to attach my 10 cc barrel syringe and attach it here and unclamp. And I'm going to withdraw about 3 to 5 ml of fresh blood. And now I'm going to clamp, and I'm going to put this in my packaging, and I'm going to attach my IV back on. I'm not going to flush this with heparin lock because I'm gonna put the infusion back on. unclamp, unclamp, restart the infusion, okay? And now I'm gonna come back and I don't have to worry about it anymore. So now I'm going to grab my vacutainer and I'm going to attach my specimen to it. And here I have the blood specimen containers. Now the order of color is important because they contain some additives. This one here is contains the additive called sodium citrate, and I am collecting about 1.8 ml. So I'm going to connect it, and this is a coagulant for coagulation. So this tube has already been used, so I'm going to help it out a bit here, but it would automatically suck out the fluid. And then I'm going to remove it, and I'm going to invert this 3 to 4 times. 1, 2, 3, 4. Place it down. And then this one here, you want to do it second because it contains an additive called EDTA, and it is an anticoagulation test tube. So this I'm going to collect about 3 ml, and I'm going to connect it. And this is a used test tube, so I'm going to help it out here. Okay, and then I'm going to remove it, and I'm going to invert it 8 times. And I'm going to toss this into the biohazard container. And now I'm going to initial date and time both of these. And I'm going to put it into my hazard bag, and I'm also going to initial date and time it, make sure they both match, and you insert it on the outside of the slot here. And I'm going to place this aside, and I'm going to document what time it was stopped, the type of lumen, how much of blood I withdrew, how much normal saline I flushed with, and if I found any infiltration, anything around the site while I was here. So now that I have done all this, I'm going to remove my stuff, I'm going to remove my gloves, and I'm going to wash my hands. So now I'm going to perform a dressing change on you because it's due every 4 days. Is it okay for me to proceed?
Yes.
Okay, so I'm still here at bedside. I have gathered all of my supply here. I have a ruler, have my microbial patch, my Cavalon, and my dressing change kit. And I am going to pull it away, pinch it out, pinch out my sterile gloves, pinch out my mask, and this mask is for my patient. Can you put this on for me? And I want you to look away, okay? And now I'm going to remove my sterile, put that to the side, and I'm going to open it by the 1-inch borders, shiny side down, and I'm going to dump all my stuff within the 1-inch borders, toss that in the trash, open my microbial patch, toss that in the trash. I'm going to open my Cavalon and leave it to the side here. And then now that I have everything I need, before I open my sterile gloves, looks good, I am going to then put some gloves on. And I'm going to assess the site for any infiltration, any redness, any warmness. Okay, everything looks good. I'm going to remove the transparent dressing, forward the insertion site. Okay, I'm going to toss that in the trash. And now I'm going to inspect the central line here, and I'm going to measure it in centimeters. And the reason why I want to measure it is to see if it is the same length as it was when it was inserted. So it is still at 12 to 13 centimeters. Okay, and now I'm going to remove my gloves, wash my hands. And I got everything prepared here. So now I'm going to put my sterile gloves. These gloves are so small. And I'm going to fix my gloves here. Okay, and then toss this into the trash. So now I'm going to grab my chlorhexidine and I'm going to pinch this, shake it, and then I'm going to do circular motions around the site, and I'm going to work myself outwards. Okay, toss that in the trash. I'm gonna grab my gauze and I'm going to grab my alcohol swab stick. Gonna pinch the line here. I'm gonna start inward and then clean the line outward. Okay, and then toss that into the trash. Now I'm gonna grab my microbial patch, making sure it's slit down. And now my hands are no longer sterile because I'm actually using both of my hands to touch the patient's chest. And I'm going to grab my transparent dressing, put it here. I'm going to grab my Cavalon. And this Cavalon, what it does, it will keep the transparent dressing on, and it won't take off the patient. So apply here. I know. Just like that. And now I'm going to initial, date, and time it. It is 15:20. Okay, looks good. And now I don't have to secure the line because it is currently infusing with the doxorubicin right now. But if it weren't to be infusing, I will secure it around with tape. And now everything looks good. I'm gonna collect my trash here. Toss it into the trash, remove my gloves, and then wash my hands, put the bed down. Okay, so here's your call light. Do you need anything else?
No, I'm good.
No? Okay. And you can keep the mask because we have a COVID outbreak, so I'm sure you need it. Okay?
Thank you.
Okay. All right. So then I will walk out of the room and I will document the the time it was infused, that if I were to take it off, that I didn't take it off, any infiltration, any redness to the site, and that's it.